Ring, ring, ring. Hi there, welcome to Healthing BC. This is Magdalena speaking. How may I help you?
Hi, my name is Sarah, and I had a baby a week and a half ago, and I'm just worried that she's not getting enough milk.
Hi, Sarah. Thank you for reaching out and calling us. Okay, well, congratulations to begin with about your new baby. So you are feeling like she's not getting enough milk. So can you describe a little bit about the signs that have led you to think that maybe she doesn't get enough?
Well, my breasts don't ever get really full. Like, some women describe having very full breasts, and that my breasts haven't changed that much. They don't seem to get really full before feeding.
Okay. How does your baby seem after your baby comes off of the breast? Does your baby seem satisfied or still kind of finicky?
No, she seems good. Like, when she comes off, like, she's usually kind of sleepy. And like, she's got kind of like a glazy look on her face. Like, she seems content, but I just worry that I'm not producing enough.
Okay, so that's a good sign that she seems like she's content. I think that it's actually a common concern for a lot of women to feel like they are not producing enough breast milk. They're just not sure if their baby is getting enough. So usually that is rare that you aren't producing enough breast milk. But there are a lot of things that you can just make sure that you're checking to make sure that the latch is proper, which might be something that's interfering with breastfeeding. So can you tell me a little bit about the latch? Are you having difficulties with latching, or does it seem like your baby is getting a good position?
Well, I think that she's latching well. Like, it doesn't hurt anymore, like it did for the first week. And the public health nurse came and did a home visit, and
oh, good.
She seemed happy with the way the baby was latching, and I think she's still latching the same way. Her mouth's open pretty wide when she's feeding, so...
Okay, so it doesn't seem like she's just on the tip of the nipple, but rather, like, can you see the areola around, or does it seem like the baby is quite far onto the breast?
No, it seems like she's pretty far on there.
Oh, good. Yeah. Okay. Okay, and how about wet diapers? How many wet diapers does your baby usually have on average within a 24-hour period?
Yeah, I've been counting them because I was worried. So
good.
She's had about 7.
7, okay. Okay, well, that's also...
Yesterday?
Okay, yeah. That's a good sign. Usually we're looking for a minimum of 6 wet diapers within a 24-hour period.
Okay.
And how often would you say that you're feeding her?
Yeah, like, she eats at least every 3 hours. During the day, sometimes it's more frequent.
Okay. All right. So that also sounds good. Usually we kind of recommend that moms aim for a minimum of 8 hours in a 24-hour period in terms of frequency of feeding. All right. So I appreciate that you called with this concern. That's definitely so that you don't feel alone. Definitely a common concern among new mothers, especially. There are definitely some things that you can do also just in terms of your lifestyle to make sure that you are maintaining sufficient milk supply. So things like reducing smoking, eating healthy, exercising. What has your lifestyle been like? Do you feel like you're getting enough rest and physical activity?
Well, I mean, I just had her a week ago, so I'm still recovering. But like, I drink a lot of water.
Oh, that's good.
And I try to eat pretty healthy.
Okay.
I don't smoke. So
okay, good.
That's not an issue.
So drinking a lot of water is definitely really important as well. Just in terms of the baby's mucous membranes, does it seem like your baby is hydrated?
I think so. Like, she doesn't... Like, she seems to... Like, everything's pink and...
Okay.
Yeah.
Okay, that's good. Okay, so... it sounds like what you're doing is going well so far. If you do have this concern, however, I would recommend that you go to see either your doctor or even seeing a lactation consultant might help to ease your mind, and they can just double check the latching and make sure that there's no problems there.
Oh, that sounds great. Thank you so much.
Yeah, you're so welcome, Sarah. Thank you for calling. Good luck.